Recording on. Great. All right. Welcome, everyone, to the Early Childhood Coalition statewide call. I'll pull up the agenda after we do a quick intros, but let's just do our usual name, location, where your coalition is based out of. And then I was thinking I just took a quick walk before jumping into this call, and it's as people probably know, wildflower season, one of my favorites. So maybe if we could all, as our check-in, just say your favorite flower.
I love it.
Name your coalition and your favorite flower. Entertain me. Thanks, everyone. Let's start. My name is Erin. I'm with the 0 to 5 initiative. The part of a co-facilitator of these calls. And one that I love is the balsam root. They kind of look like bunches of sunflowers, sort of, and they're all over the North Hills of Missoula. They're really happy flowers.
Okay. I can go next. I'm highlighted green for some reason. This is Stephanie Martin, Program Manager with Healthy Mothers, Healthy Babies. And I would say my favorite wildflower, I think they're called shooting stars. And I have a vague feeling that they smell like root beer. No one else has ever verified this with me, but I feel like they do.
I'll believe you. Thanks, Steph.
Yeah.
I'm Kristen. I'm in Billings. My favorite flower is a frosting flower on a cake.
Hi, Kristen.
Hey guys, this is Passover in Butte. Oh, sorry, did I step on somebody? I'm the 0 to 5 collaborator over in Butte. My favorite flower is the jasmine, even though it's not a wildflower technically.
I'm the family engagement coordinator under the systems project. My favorite flower is probably.
I'm Alex Rhodes. I'm the community council coordinator for the systems project in Butte. And my favorite flower is an Indian paintbrush.
Thank you all.
I'll try to jump in there. This is Pam Tonich. I'm in Helena.
Hey.
Hi. I recently joined Addictive and Mental Disorders Division at the state as a project coordinator. And I am a big fan of wild daisies.
Lovely.
Thanks.
Well, welcome, Pam. Pam's a guest today, and so we'll be learning more about Pam's work and, how it intersects with ours.
Thanks, Stephanie.
Yeah.
Hi, this is Anna in Missoula for the Best Beginnings Healthy Start Missoula Coalition. Stephanie, you stole mine. I was going to say shooting stars as well, but it's kind of like picking your favorite kid or something. I don't know. It's kind of hard. And then this is Pam.
Hi. So I'm Pam. I'm the new Family and Community Health Specialist under the Strengthening Montana's Early Childhood Systems Project. Quite the acronym. So SMEX is what I like to call it. And favorite flower would be bleeding hearts. They just think they're pretty, but you can't draw them. They look weird.
Thanks.
Hi, this is Brandy Locke, and I am the Family Engagement and Coaching Coordinator for the SMEX grant, which is a pretty good acronym that you use, Pam.
That's a good one.
I am the Strengthening Montana's Early Childhood System Project for people, and my favorite flower is the poppy.
Thanks, Brandy. And Brandy's sitting in for Sally this month, but Brandy, you're welcome to join our calls whenever you want.
Thank you.
I see April.
Hey everybody, Bree here.
Oh, hi Bree.
I love lilacs this time of year. From Healthy Mothers, Healthy Babies.
And this is April, and I like some lavender because God knows I need a lot more calming in my world. So, I'm in Mineral County, and I'm a family coordinator, early childhood coalition coordinator, PAT person, all kinds of stuff. So lots and lots of hats.
Cool.
Thank you.
Welcome.
Hi, this is Kathy Helmuth, Richland County Best Beginnings. I am very partial to the wild roses. I have some of the wild yellow ones I love, and I love the pretty pink prairie roses.
Oh,
lovely. Thanks, Kathy.
This is Pam from Glendive, and I like Gerber daisies.
Oh.
This is Linda Best from Anaconda, and I love daffodils.
Lovely, thank you.
Hi everyone, it's Sarah. I'm the coordinator in Gallatin County.
Anyone else?
This is Cindy Green from Fonda with the Best Beginnings Coalition. I'm the Family Engagement Coordinator. My favorite wildflower is Calypso Orchid, otherwise known as the fairy slipper.
Thanks.
Hi, this is Kirsten Smith. I'm supporting the state with the Strengthening Montana's Early Childhood System project, and my favorite flower is the peony.
Ooh, good one. Thanks, Kirsten.
Yeah.
Hi, this is Kay Medicine-Bowl. I'm from Northern Cheyenne Best Beginnings Coalition, and I'm kind of sitting in for June. My favorite flower, I have no idea.
That's okay. You're still welcome. Thanks, Kay.
This is Mark Kelly with the Funders for Montana's Children. I'm in Helena. And this time of year, my favorite flower would be the pasque flower, which comes up just after the snow is melted.
Nice, an early one. Thanks.
Hi, this is Beth Branham. I'm from the Great Falls Early Childhood Coalition, and I really like sunflowers.
Great, thanks, Beth. What do you think, Steph? Is that everyone?
This is Whitney Dans with Confederated Salish Kootenai Project Launch. And I have to just agree with Stephanie with the flowers that she likes, and I also can verify that I remember them smelling like root beer. So.
Case closed.
Yep.
Thanks, Whitney. Okay. Oh, and Jen Bloomberg is on the call too. She doesn't have a microphone or camera. And then it sounds like we're done with intros. Thanks, everyone. Good group today.
Yeah.
I'm going to share my screen for those folks who have who are on the call with the agenda. So we've got a couple updates, and I was thinking, Zoe, about just moving you right after the update so that wherever the conversation, the topic of conversation goes, we'll just run with it. But let's start. Brandy, do you want to kick us off with some updates about the grant?
Sure. So we are Currently in the process, Kirsten Smith that's on the phone and Bloom Consulting are just in the process of doing the final touches on the needs assessment in hopes of getting that out here soon as a preliminary draft. And then she's also in the process of scheduling strategic planning sessions around the state. Some have already been scheduled, and there's just a couple left to schedule so that we can begin that process of strategic planning around the needs assessment and the focus groups that they've held. And right now we're just kind of moving along with getting all of our grant partners together to really clearly identify and define roles and responsibilities, and how each of the work that our grant partners are doing are separate, but they all intersect with one another. And so just defining those roles, and we've got a meeting set up for that on June 10th. And then on May 7th, we had our first phone call similar to this one around family engagement for the coalition. And most all of you are aware, I'm sure, about the coalitions as part of this project. Depending on their level of funding, many of them are hiring family engagement coordinators to serve their community. And so they are in the process of getting hired or onboarding as we speak. And so on June 18th, we have a meeting to meet with all of them and begin networking across the state with family engagement work, and then also to really define that role and what it looks like. Recognizing that family engagement, of course, at the community level is huge with all the different services and entities that encompasses. So we're looking forward to that. And then just beginning discussions around transition within the whole early childhood system, including kindergarten transition and what that looks like, and also beginning conversations around developmental screening using the ASQ, the Ages and Stages questionnaire, and the social emotional component of that. And so I appreciate you guys letting me hop on here for Sally, and I hope to join you as we kind of move along, and excited to work with all of you and how this work all definitely intersects together. So thank you.
Thanks, Brandy. Any questions that anyone has for Brandy? Okay, well, she'll be on the call if anyone thinks of any. Steph, you want to share a legislative update? And you're on mute.
Okay. Let me pull up my little cheat sheet here. So one of the things that I will say, as I was preparing for this legislative session or this legislative update, I was like, man, that was forever ago. But indeed, it has not been all that long ago. So I think I'll start out with the big one. I think most of you probably know Medicaid expansion did pass in our state, and it was a really interesting process in how that bill was really an example of some bipartisan work, that compromises were made on both sides throughout the legislative session, and there was a lot of hype beforehand and a lot of good fear about whether or not Medicaid expansion would pass. And at this point, this was impacting more than 90,000 people. And so it's, I think, healthcare for, 1 in 10 people in our state. So it's really impactful, and I'm really impressed with what came out. There were some concessions in terms of adding work requirements, which they ended up referring to them as community engagement pieces. There are some pretty good safeguards put into there in terms of exceptions, making sure that, you know, if you are unable to work the 80 hours per month as required, that there are exceptions for that. And then there's also some monitoring and follow-up to kind of audit, you know, if someone is suspended for not following engagement or community engagement rules, their folks are required to audit who is disenrolled and to report to on that publicly, which I think is really important and is something that was lesson learned from other states. Notably, this is a national conversation, and work requirements have been struck down in a couple of, I guess they would be district courts. And so it's an ongoing thing that that bill also, or the Medicaid bill that passed also addressed if those are deemed illegal or unconstitutional, then it is prepared to revert back to to a system without those community engagement.
Oh, shoot. We lost you, Steph.
I'm not sure why it's losing me.
Yeah, there you go. You're back.
Am I back? I'm sorry. Yeah, did anybody have any questions specifically about this? There was a lot of moving pieces, and a lot of reporting went into it appropriately. But does anybody have any specific questions about that? All right. Seeing none or hearing none, I will move on to the saga of preschool. Oh, did I hear somebody? Nope. Okay. I would go ahead and say that by the end of the legislative session, preschool was a very loaded word on the Hill, and it was something that was a point of frustration. We have this incredible ally for preschool in the governor, and that also, it's a double-edged sword in the sense that you have incredible support for that work, but also at the same time, anybody who might be opposing preschool or looking to leverage knows that this is incredibly important to this administration. And that kind of played out in the final weeks of the legislative session. They ended up trying to pass a couple of different preschool bills in what are called conference committees. I don't know if any of you read any or heard anything about that, but they were totally new to me in terms of the legislative process and were by far the least transparent legislative process I've encountered. And so it was a little bit frustrating for a lot of folks. And so there was no bill supporting public pre-K was passed at this point. And this actually includes, as far as I understand it, the loss of some of the current pilot sites for the STARS pre-K. That's a step backwards for sure. But looking forward into the next 2 years, and as we, as advocates for preschool and, early childhood education more broadly, I think there's a lot of education that needs to be done about what the difference is between childcare and preschool and pre-K even. And I think there's some incredible opportunities for education at this point. So hopefully some folks around the state will be able to kind of organize and rally around that and get that conversation moving a little bit more robustly than what it had before. So it's a little frustrating, but it is where it was. Is there any questions on the preschool or pre-K? Okay. I think one other thing that I talked to you guys about, and then I also asked you all to take an action through the 0 to 5 page, was HJ60, which was a study bill run by Kathy Kelker. And it was heard in the House Education Committee and did actually create some really interesting conversation there, and had let's see, it just timed out basically, and so died in the legislative process. They decided to end the legislature before that was able to move all the way through over to the Senate, side. So the study bill didn't get through either, but yeah, I don't know. Does anybody else have any specific questions about any of other legislation we talked about throughout the year or throughout the session? No? Okay. All right. Well, I think that's it from my end of the legislative update. Okay.
Actually, I do have a question, if that's okay, Stephanie.
Absolutely. Thanks.
As I've done this, I'm doing this needs assessment, advocacy and kind of organization feels like a gap. And I'm just kind of curious, obviously like this group, or maybe not this group, but there's MAC and it's kind of its role. And I'm just curious what work is done to get parents and providers kind of organized around these issues, like making sure we're funding early childhood sufficiently.
Yeah. You've identified a gap correctly, in my opinion. There are a couple of organizations that I think do this to some degree. Are the Montana Advocates for Children is a group that Healthy Mothers, Healthy Babies is a part of, along with the Montana Association for the Education of Young Children. Or Head Start folks are a part of that. Child Care Resource and Referrals. And I mean, that's a small group of people with a small budget. And there is definitely room for more people at the table. And there's room, I think what I like the most about the way you framed your question was, there's room for parent voice at that table. And specifically as the parent advocates, it's within our conversations, we often can rally childcare providers or preschool teachers or different things. It's harder logistically to get parents to some of those sessions a lot of times. And so we're like, well, we're also parents and we also teach, but having that distinct voice. As far as I know, there's not a ton of other organizing that goes on. Yeah, but if anybody else, does anybody else on the call have any input for Kirsten?
Yeah, this is Anna. I had a question just as far as if there were talks that were going to be started with the Federation of Public Employees kind of in the meantime, because they were the ones that were so opposed to the plan.
Yes.
I feel like a 2-year buildup would be more helpful than, they drew their hard line and there was no going back from that during the session. But
yeah,
kind of, that seems like an avenue that would be interesting to tackle.
A very interesting avenue, and one that I would say I was very surprised was not more, I don't know, and part of advocacy is you bring along people with you, and that federation is incredibly powerful, and they weren't brought along in a lot of these conversations, unfortunately, and so we ended up with this deadlock where they've very much felt that providing funding to private entities was a way to start chipping away at public funding for schools. And there's arguments to be made for that. That's happened in other states. But it also is very difficult in the sense that we have such a low number of providers currently, that you don't want to just on principle cut off access to really important services for a lot of families, both economically and then also those long-term benefits of that early care. So I can see exactly where they came in opposed to that, and really did in that last minute strongly oppose, and I think swayed some of the legislators that were sitting in those conference committees. So they would definitely be a group that you would want to bring along in future conversations. Thanks, Anna.
Yeah.
But in terms of Anna's question, no one is speaking to them now. It's post-session, is that correct?
Not that I'm aware of. Our group is not, and I haven't written them any personal emails either. But it's kind of I feel like dust is settling in some of those things, but there's also a really wonderful space for people to step in and start organizing on this. Hey, Erin Barstow, would you like to, in the upcoming 0 to 5 hosted childcare conference at the end of this month, will that also include conversations about preschool?
Well, good question. The summit's focused on engaging businesses. So, and policies are, parental leave policies are a big part of that conversation, and policy paving the way for businesses to engage. So I don't know the answer to that, but I can find out.
Cool. I was just wondering, I was like, I wonder if that's a place that'll get discussed. Yeah. And Brandy, do you know of anybody at like the state? I mean, this is definitely not a place that the state can do a lot of advocacy. Clear limitation there, but yeah, if you know of any conversations that are happening.
I don't. Is that Kirsten?
It is. Do you want me to interject because of some of these other parallel conversations?
Okay, there you go. Yeah.
There are conversations about boosting up like the educational materials that are out there for folks, and so some of that is being worked on through the grant and activity 3 family engagement, as well as the providers support professional development and activity 4, and some of that is kind of coming along. But in terms of the advocacy role, no, it's more like we're working within a shared framework where we have a component of the system talking about commitment and like developing commitment for early childhood. And I think the state really sees an opportunity, and we'll look to sort of fleshing this out in the strategic planning conversations coming up for some, partnerships with some of the amazing organizations who are on this phone now to really figure out everyone's roles to support the commitment building work. So the state having a part in like getting material and information and supporting that along with others. I mean, the great work the Funders for Montana's Children are doing, it's like, we love that. And, but then thinking about the whole advocacy and getting people together and how there's a gap there and there's a need for someone to help fill that. And we're hoping that maybe we can figure out a way to do that better.
Great.
Yeah, 0 to 5 is definitely having those kinds of conversations too. And I know we've got some, now that the session is over, we'll definitely have some more strategizing opportunities and networking with the state grant around this policy piece.
Okay.
So,
awesome.
Yeah, there's a lot to look forward to, I think, for this next legislative session.
Cool.
Awesome.
And I was just going to say, this is Brandy, and I was just going to follow up on that too. I think just by nature of this, in-depth family engagement work, that hopefully there can be a real emphasis on families advocating for themselves and advocating for their children, which then, would move forward to that advocating for some of these programs as well.
Yeah, excellent. I have a couple of other ones that I know I talked about in this group. There was a peer support bill, and this doesn't directly impact us, but it is an interesting update and might impact some of your entities. So peer support is a model that is specifically comes out of substance use treatment kind of world, and these are folks with experience with a substance use disorder, and then period of time after that, and they have received specific training in order to be peer supporters, and an incredible evidence-based project or program, or I guess I should say intervention, it's not a program, that is now payable by Medicaid thanks to a bill that was also a bipartisan effort, I would say, that went through the legislature pretty swimmingly. We have high hopes that, one that'll help to shore up the lack of workforce in substance use treatment in the state, which definitely impacts all of our families that we work with. And so that's one of those big bright pieces. And so thinking about maybe what peer supports look like in other settings, and specifically thinking about like what does that look like maybe in parenting settings where you're also dealing with substance use disorders within that family set or within that family group. So that is also a very exciting piece that I think is another bright spot of the legislature. Yeah. Yeah. Any others?
This is Kristen in Billings. Can I ask you a question about the peer support bill?
Yeah.
We were talking about this at another meeting here in Billings, and our substance use providers are like super concerned that the substance abuse language came out of that bill at the end. Yeah. And they're very concerned that only mental health was left in. Can you address that? I mean, they basically feel like the bill is not going to work for them anymore, or substance abuse treatment providers.
I've also heard that same concern, Kristen. Thanks for bringing that up. I think one of the things that group is really hoping, instead of having really defined legislation that's targeted to its really small, they can have these broader pieces of legislation and use those specific kind of more of those specific policies to the board of licensure. And that adds another level of opportunity for complexity and also advocacy. So the push to not have a super specific bill and instead broaden it to mental health, which still encompasses substance use. And so I think the place where it now needs to be addressed by folks that are concerned is the board of licensure. And that will be a different, that'll be kind of a different conversation. I've never experienced this. There's also national or the social workers, National Association of Social Workers, the Montana chapter led through a bill that is specifically looking at some accreditation and licensure levels within social work that exist in other states. So they'll be engaging with the board of licensing as well, and I'll be engaging with that process through them. So I know that this will be another place that has to get addressed. But yeah, it's not ideal, and it didn't come through with that same language that came out of because Jen Gross from Billings ran the bill, and
our people that are concerned were like in regular contact, and as soon as they saw that stuff come out, they're like, no, you have to put that back in, and it somehow got through without, and then our legislators were kind of like, oh, oops, sorry, but I don't know. I guess I'm not an expert. I don't do this stuff at all, but the people who do it are basically telling me that the way that it's anymore, then, and I understand but the way it was written before, I understood it had substance abuse and mental health, which is how the funding streams come down in our state. They're separate funding streams. And so by taking substance abuse, I guess their feeling is that by taking substance abuse out, it's not like it was widened, it's now narrower, because now we can't use peer support. This bill, from their point of view, this bill no longer applies. And they're the ones who are running the peer support programs. And now there's some peer support, there's some funding for those crisis intervention teams, or is it the crisis intervention? Yeah, and teams as well to add peer support.
Okay.
But anyway, I don't know.
Yeah, I would love to connect with those folks. If you could connect me with them to figure out, what the heck happened there.
Yeah.
You know,
And what do we need to do? And like they said at that meeting, they're like, oh, well, they're telling us it's going to be okay. But from their point of view, boots on the ground, you know, they do this billing. They've built the peer support system in Montana.
Yep.
They don't feel that way. So.
No, that's not a good thing. Folks that don't feel like they're going to be able to access that bill are not going to use those codes, and they're not going to bill for those services.
And these are the people that help put the bill together, right?
Yeah,
so
that's
like
not a
they
great
know
day.
what they're talking about.
Mm-hmm.
So something's going to have to be fixed somewhere.
Okay.
I don't realize too much, but it is pretty relevant to our work.
Absolutely. Yeah.
So
can I just ask a clarifying question? Oh, sorry. Go ahead. I can't. The CSA for you.
Are you sure? Okay. Sorry. This is. I just might have something to throw in with this. This is Pam at AMDD at the state.
Thanks, Pam.
And I haven't seen the bill, but is the wording behavioral health?
Right.
Is that what's in the bill?
I don't think so.
Do we know? Okay, because one of the things that I've been learning in my short time here is that we are now blending the world of substance abuse and mental health into the term behavioral health. And as a mental health professional myself, that generally says mental health to me. So I've been corrected a few times because I actually was told today that like the mental health advisory board is being renamed the behavioral health advisory board so that it brings in substance abuse.
Good.
Yeah.
So that's coming down from the state level, if that is helpful at all. Because I really don't think that was at all the intention of that. I haven't looked at it, but of course they want to keep substance abuse providers in, I would imagine. But anyway, it might be semantics.
Cool.
That was my question too, Pam. I was assuming it hopefully was to behavioral health, not mental health, so it would be all inclusive.
Right, okay.
Well, I will definitely look into all that and probably come back to both Pam and then and Kristen on some of those concerns that are happening in those groups, and then maybe be able to bridge, or at least connect to where in the process rulemaking might be. So that folks that feel like, oh, I need to say something, I need to advocate here, know what audience they're trying to connect with. Thank you guys for that conversation. That's good stuff. Okay. All right. Any more burning legislative or advocacy questions? All right. Thank you all very much. We've got, I think 20 months now before this happens again. So
there you go. You can do our monthly
get ready.
Countdown.
Yeah.
Thanks so much, Steph. Bree, if you're still on the call, we didn't put in a space for you. Sorry about that. But of course, if there's any Healthy Mothers, Healthy Babies updates you want to throw in, we'd love to hear them.
Cool. Let's see. We are working really closely with
where'd you go?
Am I there?
There you go. Yeah, there you go.
Hi. Hey, so we're working really closely with Kristen Rogers' shop and CSFC FSD for Safe Sleep, and we're starting, we've done a bunch of big rollouts for cribs, and we are moving into making a plan to train the CPS workforce about safe sleep and to, prepare them with materials such as pack and plays, education, sleep sacks, all those kinds of goodies. We're going to be training into the summer. And there also is a potential we'll be able to train on maternal mental health and with that part of our workforce. So that's a big win. And some of you guys know about Healthy Mothers, Healthy Babies, Safe Sleep, and Safe Seats for Baby programs. So we, for a long time, have distributed cribs and car seats to families in need. And all this crib work has really tapped out our car seat resources. So the state has heard our need, and they are responding with resources for car seats as well. So that's coming. So we can expect more car seat access for families. And we've also started talking about diapers and wipes and sleep sacks and some of those other necessities for early families. So I just wanted to say I was grateful to the Family and Community Health Bureau and the Children's Trust Fund for their support. And that's, if you guys need cribs for your programs or share them with your networks, send the requests our way, because there is resources right now. There is specifically a lot of resources for safe sleep for native babies. So anybody that's working with that population, please don't hesitate to ask for a lot of support. Another issue is we are going to have our second perinatal mental health conference. Save the date, November 7th and 8th. We're bringing back the ladies from Maternal Mental Health Now. We're still finding a location, so stay tuned for that. But if you'd share that with your networks, save the date, November 7th and 8th. It should be another great learning experience. Let's see, a win for our Children's Health Data Partnership Project. The Children's Trust Fund has integrated the data measures into their RFP process, so that is a really cool outcome, and one of many, hopefully, from that project. We are submitting a grant back to the Montana Healthcare Foundation to continue that work, so we'll find out this summer if we're re-granted to do that project, and if not, we'll work within our capacity to keep that on moving along. So we'll do some formal updates on that project after we find out about the grant, so we can have an accurate work plan. Steph, can you think of anything else I'm missing? Just kind of high level HMHB updates.
You're on mute.
This thing. So we're continuing work with the Healthcare Foundation on the Perinatal Behavioral Health Initiative. That's expanded to 5 more communities. I will be visiting Livingston tomorrow. I'm going to go talk to Jacqueline there, or maybe it's Jackie. I haven't met her yet. Only via email. And then Billings the next day, and was in Bozeman today. So yeah, that's definitely rolling. And if I'm in one of your communities, more than likely I'm going to be reaching out to you to figure out how the ECC there and all of your kind of partner orgs in your community can be involved in supporting the hospitals in, improving perinatal care in the state of Montana. So very exciting. Yeah, I think other than that, you nailed it with the car seats and the cribs and all that good fun.
Awesome, thanks for those updates. I'll just share just a blip from 0 to 5. We've all been thinking, oh wait, let me share this one first. So I meant to actually email this out, and we've talked about this before, but there's this beautiful partnership between a few different organizations. I'm gonna share my screen again for this. Okay, hold on, I'm having a hard time multitasking. I just have to focus on my screen. Give me 1 second. Hold it up, but I have way too many tabs. Folks, see this? The Child Care Solutions to Support Your Workforce. People see that on their screens?
Yeah.
Great. Okay, so this shouldn't be new information. It's next week. We talked about it in our last monthly meeting, but this is a summit that's aimed at business leaders. You are welcome to attend. Strongly encourage that you bring in those business leaders that you're hoping to engage. But I was highlighting the all these awesome organizations and departments that are joining forces to offer this. So more to come on business engagement, but this is kind of, we're excited about this collaboration. Lieutenant Governor Mike Cooney's going to be there. We've got some great speakers. The registration link, that was yesterday, but there's certainly, if you really want to go or some people, give them a nudge, and no one will be excluded. Please do it soon if you do want to attend. And I'll send a link in an email afterwards too about this, more information. Cool. And the other thing I was going to say is that 0 to 5, we've been thinking about how to support our early childhood coalition friends through the work that we're doing. And one thing we're brainstorming is our communications strategist, James, has been putting together presentations for our collaboratives, definitely, but also for Head Start. He's working with and other big organizations too about communications and messaging, so developing platforms. He's got really this 7-step process about, I can stop showing the screen actually. The 7-step process to build, really to acknowledge who your audience is, what they want, and how to create effective calls to action. So I'm hoping to ask you all if this is something that you would find interesting or useful. And this can be, so first of all, is this something you're interested in? Would you like some help with kind of creating messaging and communications around either bringing diverse community members to your early childhood coalition table? Would it be relevant for your specific organization? But one thing we're thinking of, if we could either use this platform, this call, to house an 1.5-hour workshop with James around communications and messaging, or we could offer, kind of create a new space. So another webinar, find a time that works for a bunch of people to join for a call. Other options is if you want this for your organization or your coalition, James can come in and lead as many hours as you want to walk you through this messaging platform to create these calls to action. So there's lots of different opportunities, but it is being, like I said, a lot of organizations are starting to reach out. So I thought this would be a great platform, a great audience, as we're all, especially as we're talking, our topic of conversation is engaging smaller communities. So looking to engage diverse folks in this work, this could be a resource. So I'm wondering, I can certainly follow up in an email, but I'm curious just to screen folks if people are interested and if they want to do that as part of this call or organize a separate call. You can chat, you can call out loud.
This is Anna Missoula. I think it would be useful, and I mean, to me it makes sense just to do it in this call since we're already all assembled and have it on the calendar. And I could see it being useful to present to coalitions, but I think for coordinators understanding what we want out of it and what that potentially could be would be better first.
Okay, yeah, so follow-up could be get a good dose of communications and messaging, and if you want to bring it to your community afterwards, certainly can. It's a free resource, basically, you should add. Thanks, Anna, for your feedback. Also hearing that this call works from folks in the chat. Messaging, crafting messaging we can all commit to, and yeah, there can definitely be some interactive part. I'm reading your chat kind of built in about creating collective calls to action. Yeah, that can definitely be part of it. So more of the what rather than the how. Yeah, that's great. Okay, well, feel free to keep chiming in on the chat, but it seems like folks are interested. And then, you know, Stephanie, we can talk afterwards, but maybe we can, our next call can be that kind of workshop, because James, I know, is ready if we want to do that for next month.
Cool.
Okay, thanks everyone. Okay, now I'm gonna take a minute to pull up that agenda again. Okay, so thanks everyone for that feedback. You know, one thing I forgot to mention in the beginning of this call is that we're trying out this new format. I think we talked about it last month, where we're having folks write in their updates. So we still want to hear all the great work that you're doing in your communities and share that with the group. We were putting our heads together about, we talked about this as a group, about, you know, what this call can be and the time that we have together, and we decided to write in updates. And Steph, did you get a good number of those? Are we still?
I think I'm about at 50%. I'm still compiling. I got a couple more today and haven't put them all together, but you are not late, right, as of right now. So don't fret. And please know that there are some folks that have written 4 paragraphs, and there are some folks that have written 4 lines, and both of those are totally acceptable. We just want this to continue to be that information sharing. So, you know, if you find out that, you know, somebody in another county or is doing very similar work to what you're doing, then you guys can connect and hopefully learn from one another. So really anything, target things that you are, you know, still working on, still want to offer conversation on, and then things that maybe you hope to find information about from other people in the coalitions. So, yep, just keep sending them my way. No worries. And what I'll do is I'll compile all those and I'll send them out with the minutes on Friday.
Okay, we have until Friday. Thanks, Steph.
No sweat.
All right, so Pam, you chimed in, but let's give you a little bit more time to introduce yourself. Steph, I don't know if you want to give a little introduction or how you want to do that, but then we can move into our discussion.
I do not think.
I would love to introduce Pam as Bree.
There we go, Bree. Thank you. I was like, I am not going to be the good one to do this.
Well, I am thrilled to introduce Pam Ponage Hunthausen, who's been a long time early childhood / maternal mental health healthcare or mental health care provider and advocate for coalition work. And, it's great to have you back in the conversation, Pam.
Thanks, Bree. I appreciate that. Okay, so I know I'm on the phone and you guys can't see me, which is probably okay. But I'll try to be clear and quick. Before I kind of go into what we're doing, I do have a question. And maybe I missed it, but is there someone from the Early Childhood Services Bureau or Launch on this call? Yes, there is.
Sally Tilleman is a co-facilitator of this call with the Bureau. And Brandy is hired on, and Kirsten is a consultant with but Sally is a regular member, and she's in Denver this week.
Well, the question I had was about an email that was routed to me last week about them looking for some more training money to bring in 0 to 3 for infant, toddler mental health training. Do you guys know anything about that?
I do, Pam. It's Bree.
Oh, okay. Do you know if they've figured that out?
I don't know if they figured it out or not, but the launch grant, and Darla doesn't often get on this call, but she's super accessible. The launch grant had some carryover funds, and so they're wanting to bring in 0 to 3 to do a it's any therapists on the call will help. It's a certification for providing early childhood mental health consultation, and so it's this really incredibly unique opportunity to build our early childhood consultation workforce. And so I think it's a pretty penny, so she's looking for funding partners.
And I was just wondering if there's an update, if she has found any funding partners, because I'm incredibly excited that they're bringing that in personally.
Do
you know, Bree, they're still looking?
Not that I know of. Mm-mm.
Well, I think everyone should put their pennies together for this one.
Mm-hmm.
And I am working it up my chain here too, so hopefully we can help out. So thanks, Bree. I just was so excited when I saw that. It's just something that I've been pushing for Montana for a long time. So, as Bree said, I've just been a real early childhood. I'm just really very passionate about early childhood work, and I'm a psychotherapist, a mental health person by training. But when I discovered the world of early prevention and 0 to 3, and something crazy called infant toddler mental health, I was hooked, because it's after working with really tough adolescents for a long time, it was like, oh, we really can go upstream, and we need to. So I just am really excited to kind of be back in this world with you guys. And basically, Zoe brought me on about a month ago to head up a project that is a prevention project. The state AMDD, Addictive and Mental Disorders Division, did get an extra $2 million in our SOAR grant, which is the state opiate recovery grant. And it was a very tight timeline to say yes. They didn't want to say no. But it was actually Zoe that said, let's let's do prevention. And so knowing that I love to do that, and I was kind of looking for a move, she brought me over. So she also knows that to keep me around, she needs to throw me into anything that's early childhood. So you guys are just going to be running into me because I love this world so much, and it's exciting to see what you guys are all doing. Really briefly about what we're doing, and I can sure send a blurb out if that would be helpful. I kind of have a little email that I've created for folks, informational. Basically what we're doing is we're going to be rolling out more of what is called the good behavior game. I personally had never heard of it. I'm learning a lot about it. It's not as much early childhood. It's K through 3, potentially K through 5, but it's a school-based program that's evidence-based. It has rolled out in like 47 schools already in Montana through different funding sources. So what we're doing with this grant is getting the word out to as many people and schools as we possibly can that we've got some good funding to bring this training to a lot more schools. It's a pretty great program. I'm learning a lot about it. It's, like I said, it's evidence-based for suicide prevention, for substance abuse prevention, for bullying prevention, and it really is a fun way to get kids to become like better citizens, for lack of a better word. But it's a really fun way that they do it, and it works really, really well. And it's a great prevention tool. So I'm excited to be kind of in charge of that rollout. It is a very fast timeline and turnaround. So that's one reason, like, we're kind of asking, hey, can we talk to all of you people about this? Because word of mouth would be super helpful. It's great, like I said, great training, free. The teachers will get stipends so that they can put more, enhance their classrooms. Everything's going to be paid for. We just really want people to step up if they're interested. And it really is about behavioral management, but it's not something extra that they have to put it in place. It's not a curriculum. It really is a kind of a game and some fun tools. For example, the mental health advisory board, now the behavioral health advisory board, got really interested in hearing about it. And so they're going to send a blurb out because they really are going to encourage their schools and their communities to apply. So if that would be helpful for me to just send out a little blurb that you guys could maybe get out to everyone. I don't know if that would be to you, Stephanie, or
absolutely, Pam. Yeah, send out. And what I'll do is I'll pass that along with any kind of message or information you want as a attachment or an email, and we can send that out to the group for sure.
Fabulous. Because it's state government, we have to go through an RFP process. I've really whittled it down and made it super, super short and super easy, knowing that school's almost out, and we really want to get the word out fast and, to get a sense of who's interested, because we're going to be doing this training starting this summer, and really want people to be implementing in the fall as much as possible. So as you guys can tell, time is of the essence. So yeah. So I will, as soon as the RFP goes out, I can make people aware of that too. It just has to be approved. It should be any second now, we're hoping. Does anyone have any questions for me? I know that was kind of quick and an overview of all of this.
I think.
Okay, I guess the other thing just to throw out there, besides the fact that Zoe's keeping me happy by, getting me engaged in the early childhood stuff, is I'm pretty excited that, Addictive and Mental Disorders Division, that's not necessarily historically been looking at early childhood and prevention activities, is now. With Zoe as our bureau chief, it's or Zoe as our, the head of the world here, she gets it. and that's why she's really wanting us to be involved and helping out and, you know, finding resources, whatever we can do at the state level. So just know that I'm a partner, so feel free to reach out.
Wonderful. Thank you, Pam. That is, I think that is a really incredible point to make, is that, you know, a lot of times if you say, you know, addictive and mental disorders division, you know, we all intuitively get that, but for a lot of outsiders, it's really nice to be able to point out, like, this is, you know, this is where prevention starts, and this is where some state leadership is really putting their dollars and their time. So thanks for coming and presenting.
Yeah, absolutely. Thanks for letting me pop in. I really appreciate it.
Yeah, anytime.
Great. Okay, well, there's no questions for Pam. Then we might transition in our last half hour of this call to our topic of discussion. So we all, many of you selected engaging small communities. And, you know, Sally and Steph and Randy and I, before this call, and we were all throwing out that in snippets of conversations or working in communities, that this seems to be a challenge for everyone, whether you're in a small community trying to engage your fellow people in your small community, or you're in a bigger city or town within a county with small communities alongside it. It seems to be a challenge for everyone. So can't promise to have any solutions. So this is more a group to be brainstorming and sharing ideas. But this is a good space to air out kind of what our struggles are and to group problem solve too. So hope you brought some of your ideas or your struggles, and I'll open it up for folks to chime in.
You know, Erin, we're in a pretty small community in Mineral County. And when we did Best Beginnings a long time ago, where a lot of these different funding sources had originated with and everything else, we were running into a lot of blockades of getting people involved in coalitions because they were already invested in so many other things in our community. And so through that process and some other processes, we eventually came up with what we call the Healthy Communities Coalition here in Mineral County. And what that did was it allowed a lot of different grants to come to the table at one time. So it wasn't just the early childhood focus. However, we were able to bring our early childhood focus to all of those other grant programs at the same time. And we now have a subcommittee of that coalition that's addressing our early childhood stuff. But we have a much greater force behind us because we're meeting the needs of a lot of other grants and stakeholders in our community through a larger coalition. So that's how we kind of got around trying to get more people involved with what we were doing with our message about early childhood, was meeting their needs as well at the same time.
Broadening your scope. Awesome. Thanks, April. Does that resonate with anyone else out there in small communities?
That's what we've done in Richland County. We took a look at it a year and a half ago, I think, and realized, my goodness, the same people are coming to the table for the Best Beginnings Coalition that are also at the Partnership for Promise, that are also at whatever. And we consolidated under the umbrella of Partnership for Promise. So the good news is we've got the people at the table at one meeting instead of 3 or 4 or 5 different meetings. I would say what you give up in that, or the compromise in that, is instead of having an hour to talk about Best Beginnings, we are an agenda item of many others. So maybe 15 minutes if you're lucky. So you learn to be concise.
I bet you're good at that, Kathy. Thanks for sharing. What else? I don't want to put you on the spot, Cass, but I work with you. So, and I know this is a big task of yours, is to be bringing diverse groups to the table, and Butte is a bigger community within your county. So what are your thoughts on this?
I was unmuting as you called me out, so don't worry about it.
Thanks.
I think, we are a little bit bigger of a community, and in talking with folks, cohorts in the smaller communities like Mineral, like Monty and stuff, talking about ways to work with their smaller groups of people is definitely interesting. And for me, so much of building community involvement in the groups that I'm facilitating is about being really actively engaged with the activities and projects and programs for community development and community enhancement that are happening for other people. And I'm sure most of the people on this call are very aware of what else is happening in their community and are probably really engaged with that. But that is what I find to be the biggest, most successful thing in getting people to my table, is to talk to them about what I can offer them and what ways I can engage with them to help their projects that they're passionate about, and ways those projects can intersect with what we're doing. So kind of like that consolidation piece, but with Butte being a little bit bigger, we do have more folks to come to the table and be able to diversify efforts a little bit more. I also try to really strategically schedule work groups within 0 to 5. And since I facilitate 0 to 5 and our Best Beginnings Council, we can kind of help to not put too much pressure on people at once. So my work groups for 0 to 5 didn't meet a bunch of times during kindergarten screening weeks for Best Beginnings, because those same people are going to be volunteering for both things, and I don't want to ask too much of those folks. So trying to really coordinate as much as possible with other things happening in the community has been really important, and it's a little bit easier for me since a lot of those things are happening here at the Four Cs. We've also been, just to throw it out there if anybody's interested in learning more about it, our parent engagement work group for 0 to 5 has been looking at asset-based community development model, ABCD. It's the best acronym, easiest to remember in the world. And that community development model, there's a lot of resources out there for free that kind of are more aligned at bringing people to the table with the things that they are best at, the things they're most interested in. And there's lots of different ways to employ that model. So it might just be something, if you're interested, to explore asset-based community development. It's pretty exciting stuff. I think it can work really well on a small scale community level, or neighborhood community in a bigger place.
Awesome, thanks, Cass. One thing that you didn't say, but I think that resonates with what you shared, is by building trust and rapport seems to be an underlying theme of yours, is by digging into the community and being there for others, so they'll be there for you.
Absolutely.
Awesome. Thanks.
I was wondering, when HMHB was doing more work up in the Flathead about maternal mental health, we were really wanting to engage some of the critical access hospitals in the conversation, and some of the smaller communities outside of Kalispell and Whitefish. Is anybody using like video conferencing at their meetings, or to kind of bring in the outlying communities? Has anybody found that to work or tried it?
I think along those lines, this is Stephanie. I'm also wondering if any of y'all's groups have geographically tried to meet different places, or currently do, in order to get with different people, whether that's, a different agency within your town, or even a different city or a different town within your area. And bringing in those smaller, like the critical access hospital communities and different stuff into, I don't know, the more populated areas within the counties.
We do rotate counties, or rotate towns with our coalition. So we call ourselves the Traveling House Band, and we set up where we can get a space. And we have found that we're able to draw more in from that community that we're generally in at the time of the coalition meeting. So we rotate through Alberton, St. Regis, and Superior. Bree, to answer your question, we haven't had much run-ins with our critical access hospital in that sense. They are in a period of transition, so I found it a lot harder to engage them at the moment, but I'm hoping in the future to be looking at some of the stuff you're talking about and would love to partner with them on maternal health. So those are just things I think right now they're not ready for, but maybe coming down the pike.
That's exciting. Yeah, that's really good. Let us know when they're ready, because we've got some resources that'll be ready in the next few months.
Perfect. I'm going to write that down because we do have a new doctor on site that I think you'll be interested in that.
Great. Thanks, April.
Yeah.
I wish I wrote down last month who specifically mentioned this as a topic, because I'd call you out, but I didn't. Any other thoughts? We've got like a little over 15 minutes to our conversation. I want to save some time to talk about our next meeting, but maybe a few other minutes. Any other thoughts, questions, ideas? I haven't checked the chat, Steph. I don't know if anyone is contributing that way.
No, April was just checking out.
Okay.
Okay.
All right. Well, thanks for the questions and the thoughts. Those were new ideas that I heard, so hopefully they're helpful for some folks, or ideas to entertain. And we'll send them out, because I know Steph is taking notes over there like a champ. Great. So, so I think the consensus is to have I'm thinking about our next meeting. So moving on in my head, and I'll say that out loud. I'm thinking of planning our June meeting to be a communications and messaging workshop with James, with the statewide office for 0 to 5. So, but what do you think, Steph? Should we just think of a topic for maybe for July to leave that full hour and a half with James?
Well, I'm looking at, let's throw James in that as a possible topic in with some of these other next month's topics as well.
Good idea.
And then it's worked pretty well. Folks will either write in the chat box or voice what they're thinking about in terms of what you'd like to discuss in the coming months. But these, I think the 4 that are up there currently are ones that were shouted out before. So if you have a brand new one, shout it out this time or type it in the chat, and we'll see if that gets any more traction. So I guess let's first call for, are there any other topics beyond the ones that we have just mentioned here that would be of interest? Is something pressing right now that maybe we need to jump on instead of any of the ones that we've suggested before?
And for folks who don't have a screen, the topics we have are kindergarten readiness, building systems, so what does that look like? Programming best practices, pros and cons of being a coalition versus a 501c3. So how are folks setting up their coalitions? And I just threw in this communications and messaging workshop with 0 to 5.
Cool.
Is Brandy still on the call?
Yes, I am.
Brandy, would you in the chat put in the meeting dates of the ones that you mentioned at the beginning for us all? And then if you think, on to Steph's point, if you think there's something, and Kirsten too, that is a time-bound issue that you need feedback on, we would certainly want to use this to help that, since the other one's not time-bound. Whatever you guys want to do.
When's your next meeting? I'm sorry. It's in a month.
Yep.
June 18th or something. Pull it up.
Some of these topics will be covered like extensively in the strategic planning, and so I'm looking forward to having in-person conversations with folks, like the transitions, some of the building system stuff for sure. Programming best practices, no. Nothing about the 501c3 communication. Sorry, go ahead, Brandy.
I'm sorry, Kirsten. June 18th will be the coalition meeting in Helena. I'm just on the phone, so I'm not able to type in the chat box.
I got you, Brandy.
Thank you.
And that's the same day as our call, actually. So maybe that's a conflict. What's the time frame of that meeting, Brandy?
That meeting is from 8:30 to 4.
That would be a conflict.
Yeah. Yeah, because I think several of the people on this call will be there.
Yeah.
Well, we'll just make sure to organize with you outside. In the past, we've overlapped this meeting with that meeting if the coalition coordinators wanted to, so we can just check in.
Yeah. Okay. Cool. Great. Well, thanks for bringing that up. Let's put it on our radar.
All right, Erin. So Cass wanted to go ahead and add in data and shared indicators to the possible list.
Right.
And then I think let's call for votes. That feels really powerful.
Yeah, text or chat your vote.
Chat your vote. Get out the vote, everyone.
The data and shared indicators is something we're required to include at some point in this project. So, and I have some thoughts about it. So I don't know like if this is the right avenue, but it could be a place for some conversation about sort of system performance measures and then the population level indicators. You know, the work that you guys have done, and some thoughts about some potential changes to it. Oh, but I guess I won't be on the call. You can just tell me what happens.
Okay, so getting...
Kirsten, what's your timeline for needing to have a conversation on that topic?
I need to submit stuff, and it's supposed to be part of the strategic plan submission, which is going to be submitted by the end of July.
And do you know if that topic will be covered at the in-person meeting or not?
Which one? Which in-person meeting?
For the coalitions?
No, it won't be covered there. It'll be covered in the strategic planning sessions I'm having. Across the state. Yeah.
Oh, in each community or region? Okay. Not necessarily.
Yeah, I want to just sort of get some broad thoughts. Yeah, and then, yeah.
Okay, that's good to know. All right.
All right.
Yeah, thanks for keep chatting in those thoughts, and once you submit your vote, you can sign out. Thanks everyone for your time and for your feedback on what we should talk about next. And we'll communicate. We'll send out the minutes by Friday. So submit in your written updates to Stephanie before then, as soon as you can. Would be great. And then we'll also put our heads together about that June 18th conflict and let people know as soon as possible what we're thinking for the next meeting.
Great.
Anything else, Steph?
Just if anybody else if you want to shout out before you get off. Okay, there's Linda's coming in. Communications. All right, just keep coming in those votes for what you want to talk about next time. And thank you guys all for the incredible work that you do every single day of the month. We really appreciate you taking the time out to share and to be here with us. It means a great deal and really, really informs our work. So yeah, thank you.
Thank you, everybody.
Thank you.
Thanks. Bye, everyone.
Bye, everyone. Thanks, Steph. Are you taking these notes, Steph?
I'm getting it.
Okay. Seen a lot of building systems.
Yeah, these folks want to build systems.
Data. I'm gonna stop my share. Oh, and I'm gonna end the